Do different surgeries change bathing rules? Imagine finishing your surgery and wondering when you can get back to your normal hygiene routine. The answer depends on the type of surgery you had and how your healing is progressing. Different surgeries do change bathing rules because each one affects your body differently. For example, if you had a small skin removal or mole excision, you might be able to shower within a day or two. But if you had a major operation like a heart surgery or a joint replacement, your doctor might recommend waiting longer before showering or bathing. The main goal is to protect your wound from infection and avoid opening it up. Most surgeons advise waiting until they give you the go-ahead, which can be anywhere from 24 hours to several days after surgery. Until then, keeping the incision dry is very important. You should avoid soaking in baths, hot tubs, or swimming pools until your wound is fully healed. Water can carry bacteria and cause infections if the wound isn't closed properly. Showering is usually preferred over baths early on because water flows away from the wound, reducing the risk of soaking it. When you do shower, cover the incision with waterproof dressings or sterile adhesive strips if your surgeon recommends it. Be gentle and avoid scrubbing or applying soap directly on the wound. Use lukewarm or cool water to prevent irritation or swelling. After showering, pat the area dry with a soft towel instead of rubbing. If your surgery involved large or deep cuts, your doctor might suggest waiting longer before exposing the wound to water without dressings. For surgeries with staples or stitches, you may be able to shower after about 24 hours, but you should still be gentle and keep the area dry afterward. Always follow your surgeon's specific instructions because they will tailor advice based on your procedure and healing progress. Some surgeries, like breast augmentation, requiring special care. You might need to wait longer before showering, and waterproof bandages are often used to keep the incisions dry. For minor surgeries, early showering might be safe, but it still depends on how well your wound is closing. Remember, never immerse your wound in water until it is fully healed, which can take days or even weeks. Keep an eye out for signs of infection such as redness, swelling, or discharge, and contact your doctor if you notice anything unusual. Always ask your healthcare provider when you can shower or bathe and follow their advice carefully. In the end, bathing rules after surgery are not the same for everyone. They depend on the type of surgery, how your wound is healing, and your doctor's instructions. Showering is often allowed sooner than taking full baths, but always prioritize your healing and follow your surgeon's guidance to keep your wound safe and clean.